New techniques now, like ultrasound targeted to areas of the brain. Repetitive ultrasound is something that helps with certain conditions such as essential tremor. You can remove this debilitating essential tremor where somebody can't lift a cup without spilling everything, and yet intellectually they're very capable. And it's not Parkinson's disease. Their intellectual abilities are good, and we can, using the imaging guidance, target the few neurons that are responsible for this attention tremor and numb them, and it knocks them out using an ultrasound focused beam that then returns the patient to normal, smooth function of motor skills.
Well, you're apparently a mind reader as well, because my very next question I was going to ask you about was about this essential tremor. I understand by doing this mapping and then using not magnetic, but instead ultrasound and targeting these specific neurons, you're able to switch off this essential tremor with 90% efficacy.
I think it's higher than 90%, actually. It's quite remarkable. It's a new machine that is a combination of a high-energy ultrasound machine within an MR machine, so that you're using the imaging, because the brain is not forgiving. You have to get the exact neurons that you're aiming at. It's very much Star Wars-like, but and the planning takes 4 or 5 hours. It's not like TMS where it's quite quick. This is it takes a team, a neurosurgeon, neuroradiologist, and a lot of pre-planning, but it is such a dramatic solution.
It's 4 or 5 hours in getting the target, but then the treatment itself is one time.
Is
correct?
One time, yeah. Sometimes you have to repeat it, but mostly you'll get a dramatic on one side. You'll do one side at a time. And if you get a tremendous result on the one side, which we usually do, we'll go back on a separate occasion and do the other side.
How long is the ultrasound bombardment?
That's a matter of 20 minutes. But it's all about placing and scanning. You have to scan. You have to find the specific X, Y, and Z coordinate of that epicenter of the area where the problem is causing the essential tremor.
Okay, but once you've got it targeted, 20 minutes. It may be 4 or 5 hours to get it targeted.
Yeah, I would say an hour. We don't rush with this. We make one patient for the whole morning, actually.
Well, you and I have a case we're going to do together at Stanford, right?
Yeah.
We're going to do the mapping here and then go to Stanford and do the actual.
Yeah, we could do it. Yeah, I usually do this at Stanford University.
Well, I'm really looking forward to that. But now, for people that haven't looked this up, and you can go to Dr. Google or whatever and look up essential tremor, but we're talking about, if you're one of those people that holds your hand out and, you've just got that tremor in your hand, and sometimes you'll hear a tremor in the voice, you'll hear it in the vocal cords and all, and it gets worse with age, right?
It does.
We're talking about 90+% efficacy in switching that off. Again, this is huge.
It's huge. So at Smart Brain and Health, we get the patients, we screen them, we see if they're, likely candidates to benefit, and if they are, then we will coordinate getting the care at the top centers in the country.
What effect does this have with those that have tremors associated with MS or whatever?
Yeah, it's FDA approved just for benign essential tremor. There's a lot of work going on with using this same device for a number of other conditions, including OCD. There are a couple of areas in the brain where if you target this using the MRI focused ultrasound, that's what the technique is, to certain cells in the brain, there's a feeling that you can break this ritualistic cycle that OCD people unfortunately have. But I think this is an area that is also going to provide other great opportunities for this type of technology. It also works with Parkinson's, but we're not. It's not FDA approved for that yet. That's a more degenerative disease affecting more than just a few cells. So, but in this one case of essential tremor, there's so many men suffering from this, or people, more men than women, that that we can't actually get to all of them because there's so much demand for this at the moment. It so revolutionizes their and brings them back to a functioning state.
Well, this is just so exciting. I don't know how you even sleep at night.